welcome to this Medicaid-heavy edition of At Issue. We missed you terribly last week, so it's great to see you again tonight. Getting right into it, we promised you Medicaid, and Medicaid we will have. The battle lines have been clear all along this legislative session, but they just may be starting to blur. We'll look into it. And just who is driving those lines? There are people leading both the left and the right. We'll look at who each of those are. And then later in the show, signed, sealed, and delivered. Sort of. We've talked about a lot of interesting legislation this session, and some of it has already made its way to the desk of Governor Bryant. We'll tell you what is now Mississippi law. And don't forget to follow along with the show on social media. You can find us on Facebook at facebook.com/issueMPB, or if you're a Twitterer, check us out at @IssueMPB. Well, it is almost as hard to keep up with as a Tolstoy novel. We're talking about the battle over Medicaid expansion in the 2013 legislative session. The Democrats want it. The Republicans, led by Governor Phil Bryant, don't. But it's much, much more complicated than that. Here's the latest on the situation.
From the very beginning of the 2013 legislative session, Medicaid and Medicaid expansion have been contentious topics for both Republicans and Democrats. 2 months in, there's yet to be an agreement, and only weeks remain in the session.
Democrats have dug their heels in because this is an issue that is probably one of the biggest of our generation.
Be cautious, move slowly on this, and you don't have to do expansion as this year. You could go to like 2017.
So where do things currently stand? Right now, things can be easily described as, well, confusing and complicated. Issue number one is Medicaid itself, the program that currently serves roughly 600,000 low-income Mississippians. The program, as it currently exists in the state, has not yet been reauthorized by the legislature. A bill to reauthorize the program died under a deadline. It could be revived, but it would take unusual steps to do so. The current budget proposed by Lieutenant Governor Tate Reeves also funds it, but that has not been approved yet either. Then there's the giant quagmire of Medicaid expansion. So far, the issue has been mostly divided down party lines, with most Republicans opposing expansion and most Democrats supporting it. The House had a bill that reauthorized Medicaid, and Democrats banded together to kill that bill, saying that it denied them the option of later expanding Medicaid.
It was a protest vote to say, Republican leadership, we respect you, but we do not respect the fact that you're not giving something that will impact Mississippi economically and greater health outcomes, exponentially, the chance to be debated. And we had to do what we had to do, and we can kill the next bill if we have to.
The Senate passed a bill which did leave the door open for Medicaid, much to the consternation of Governor Phil Bryant. According to the Jackson Clarion Ledger, the governor is confused as to why Reeves and the Senate Republicans would leave in language that would open the door for expansion. But that bill didn't get passed to the Medicaid committee in the House, as one might expect. Instead, Speaker of the House Philip Gunn made the shrewd political move of sending the bill to the Rules Committee, where it was expected to flounder. Yet, earlier this week, there was a lengthy committee hearing held to discuss the issue, where people representing both sides of the issue testified, making cases both for and against expansion.
It would be $654 billion in federal savings if every state rejected the Medicaid expansion.
If you look at the current models, it's probably statewide somewhere around $200 or $300 million in costs incurred by hospital providers to care for the uninsured.
And that's where things stand right now. No further to having an answer to the Medicaid question in Mississippi. Rumors abound as to what will happen next. Will there be a special session? Will there be an executive order? If the last few weeks are any harbinger of the future, well, who knows?
Well, few people know this issue better than Jeffrey Hess of MPB News. He's here live with us to answer every single question we could come up with on Medicaid and Medicaid expansion. Jeffrey, with the deadlines behind us now, how can there now be further discussion of this and further action on Medicaid?
Well, just because deadlines passed doesn't mean that action and conversations and negotiations in back rooms have passed. A little bit of that has happened in the last week or so. The Hospital Association, Phil Bryant, got together in his office Friday afternoon and they had a conversation. Monday, the Hospital Association came out and did something that was a little bit unexpected to me. They backed off slightly what had been their position from the beginning, which initially, once this whole thing came out, they said, we want Medicaid expansion all the way. On Monday, they said, we're going to take a break, in their words, and we're going to see if we can come to some type of compromise. I spoke with Chris Anderson. He's the CEO of Singing River Medical Center that's down on the Gulf Coast. He'd been a vocal supporter of Medicaid expansion. Now says we'll take what we can get as long as hospitals can stay whole.
I think that everybody understands it's important. I think everybody understands all these parts are so connected, it's hard to pull a piece of it out, that they want to find reasons and ways to make it work, but clearly there are going to be boundaries that people won't cross, both at the state and the federal level. So, I mean, I do think there will be some creative solutions that are approved. I just don't know what they will be.
And Jeffrey, you said beforehand they had been staunch supporters, the Hospital Association, of Medicaid expansion, presumably because it would bring more business to the hospitals, right?
Well, the way the law is set up, partly to fund the expansion of insurance and Medicaid to more people, the hospitals really get whacked. A lot of that money that would have gone to them gets shifted to these new people, new expanded population. So hospitals are looking at their books and they're saying, we're losing this federal support. The only way we're going to get back to being back in the black is if we bring in new people who can actually pay.
Interesting. Okay. Representative Bobby Howell said in that piece that we ran just a moment ago that this doesn't have to happen right away. He said we could have Medicaid expansion or deal with this issue as late as 2017. That's the first I'd heard of that publicly.
Again, this is the way the law is set up. Initially, when it was drafted, it was assumed that states would be involved, and this was to make it a little easier for them to be involved. So the first 3 years of Medicaid expansion are completely 100% paid for by the federal government. That's the upcoming year and the 2 years after it, up through 2017. And Representative Howell's absolutely right. If the state wants to get in 2015 or 2016, they can do that. The disadvantage to that is they pass up what would be free years. In the years past 2017, it cranks down gradually until 2020, where we had to pick up 10% of the cost and the feds pick up 90%.
Interesting, and something that will, as you said, as these deals continue and these discussions continue, something we will continue to watch. Jeffrey Hess, come back and see us at the end of the program. We'll talk some more about some other things.
Absolutely.
Thanks. Well, all along we have been comparing Medicaid expansion to a battle. Now we're taking it a step further and introducing you to the main players. Is that a fife I hear?
Medicaid expansion in Mississippi so far has been a battlefield. The right is against, the left is for. And the general in this war for the right is none other than Governor Phil Bryant. Governor Bryant has been unwavering in his determination to oppose Medicaid expansion in Mississippi, going so far as to say he would sue the federal government if need be. On Governor Bryant's team, you will find Lieutenant Governor Tate Reeves, who continues to echo the message that expansion is too expensive. There does remain some tension between the two over lingering legislation that could open the door to expansion. Not as wavering, a staunch supporter of Bryant is Republican Speaker of the House, Representative Philip Gunn. He can always be counted on to follow the governor into battle, whether the war is over Medicaid expansion or anything else. And so far, much of the Mississippi Republican Party is holding strong, opposing expanding Medicaid, mainly on the grounds of expense, but there are rumors of deserters in the ranks. Who might be the first to go? Whomever it is, you can expect them to be reviled by the Mississippi Tea Party, who might just be the infantry in this battle. And finally, but incredibly important strategically in this war over Medicaid expansion, is the think tank. In this case, the Mississippi Center for Public Policy. These guys are helping to form the strategy being used to fight the war. And then there's the left side of the battle, led by one of the most united fronts of Democratic leaders that the Mississippi legislature has seen in years. This issue is the one bringing them together as one powerful voting bloc. Part of that group of Democrats is the Legislative Black Caucus. This core group of Democrats identified their target of Medicaid expansion early on and are determined to see their battle through to the end. Ground troops for the left include several different social welfare groups determined to fight for their cause. From the Children's Defense Fund to the Mississippi Center for Justice to the Mississippi Health Advocacy Program, all march towards Medicaid expansion. And then there are the providers. In the battle for Medicaid expansion, most physicians are strong in their support for the left, mainly for financial reasons, as is the Mississippi Hospital Association, who's been waving the Medicaid expansion flag from the very beginning, although that flag may not be waving quite as proudly these days. Who will win this battle? The rhetoric and the whispered conversations continue, but the answers are yet to be decided.
We aren't done with Medicaid just yet. Still ahead, we look at things from the think tank point of view. Before you run screaming, we promise you this is going to be good. And then a little later in the show, there is a whole mess of new laws headed your way very soon. What made it through to the governor's desk? Well, you'll have to stick around to find out. But before we go to break, just our friendly weekly reminder to be our friend. We're big fans of Facebook, and we want you to join us there. We have news, inside information, and all the other stuff that comes with being a fan of any of MPB's pages. Head on over to facebook.com/issueMPB, like us, and of course, reap the many benefits.
Been there. You just want to make a donation to MPB, but phones, wallets, keyboards, cards, it's too much. It's time to join the donation revolution. Try out Text to Give. In 2 easy steps, you can make a $10 donation to the Foundation for Public Broadcasting in Mississippi today. Here's how. Text MyMPB to 80888 and reply with yes to confirm. Text to Give is so easy you can do it anywhere. Oh, and remember, don't text and drive.
5 youths were arrested at 14 and 15 years of age.
They got them! You can only imagine the pressure to have this crime solved and solved quickly.
First we was all together, then they started to put us in different rooms.
What did you do? Who were you with? Who did you come with?
If they confessed, and that was that.
A lot of people didn't do their jobs.
We falsely convicted them, and we walked away from our crime.
Coming in April on MPB.
Young lives in the balance.
Locking an 11-year-old up for any length of time doesn't make sense.
I can't stand it here. I can't wait to go home. I'm never going to do nothing ever again. I swear to God, I'm not.
This kind of early criminalization is a dead serious problem.
Breaking the school to prison pipeline. Tavis Smiley reports, education under arrest.
This month on MPB.
The MPB Public Radio app allows you to listen to MPB Radio live. Pause and rewind the live audio and view the program schedule for all of MPB Radio's streams at once. You can explore on-demand content, search for stories, bookmark a story for later, and wake up to MPB Radio with the alarm clock. The MPB Public Radio app is free, available for iPhone and Android. Visit mpbonline.org for details.
Medicaid remains our #1 issue tonight on the program, and it remains the #1 issue for a lot of people across the state. So we figured we might as well give at least 2 of them a chance to weigh in on the topic. On the right, and definitely opposed to Medicaid expansion, is Dr. Jamison Taylor, Vice President of Public Policy at the Mississippi Center for Public Policy. And on the left, and not surprisingly supportive of Medicaid expansion, is Dr. Corey Wiggins, who is the Senior Consultant at the I Think Group. Gentlemen, we thank you both for coming on to At Issue this evening.
Thanks for having me.
Let me start with you, Dr. Taylor. You're opposed to Medicaid expansion. Why?
You know, my goal, and I think all of us share this goal, is high quality care at an affordable price. And I think that Medicaid simply does not deliver that. Medicaid is a broken system, and expanding a broken system is not going to help patients in Mississippi. It's not going to help the poor in Mississippi. It's also, Medicaid is bad for patients, it's bad for doctors, it's bad for taxpayers. If we look, for instance, at patient outcomes, Medicaid patients are 97% more likely to die in surgery than patients that have private insurance. Even the uninsured fare better than Medicaid patients, 13% less likely to die than Medicaid patients. Medicaid, again, is a broken system, and I think expanding it is a bad idea.
Dr. Wiggins, you disagree? Why do you support Medicaid expansion?
Well, at the end of the day, you know, that's got caught up in sort of this politics of Medicaid expansion is the people who potential benefit from Medicaid expansion. So not only are we be able to provide health insurance for 300,000 Mississippians here in the state, but in addition, we'll be able to create another 9,000 jobs. So when you look at it, an investment in families, investment in people here in the state, and job creation. So that's why I support Medicaid expansion.
Dr. Taylor, we hear the argument for the economic development aspect of this. Do you disagree that expanding Medicaid would improve the economy, perhaps?
I definitely disagree, and the state economist agrees with that perspective. He testified this week that Medicaid will not create jobs. It will not boost economic activity here in Mississippi. And he's referring to the report that he wrote. When we talk about the 9,000 jobs created, this is coming from federal spending only, but it does not account for things like state spending on Medicaid. It does not account for jobs lost in the private sector. We know this is from a study done by the economist Christina Romer, who designed the stimulus for President Obama. She writes that for every $1 tax increase, we lose $2 to $3 in the economy. And we know that Medicaid expansion is going to cost the states about $800 billion nationwide. So if those numbers are correct, that's going to be a $1.5 trillion drain on the U.S. economy. Likewise for Mississippi, as the state economist said, we're not going to have net new jobs. It's going to be a job buster and a budget buster.
That's a picture of gloom and doom, Dr. Wiggins. What do you make of that?
I would disagree with that. Again, referring to the study that we're talking about, if you read the study as the researcher, economist who wrote it, he talks about the net fiscal impact to the state. We're looking at about 2025. We're looking at maybe about $98 million in terms of the net impact on the state, on our general fund. In addition, we're looking at adding another $1.1 billion in federal funding coming into the state and creating these jobs. So what we have here is a situation where we have public investment from the government and private job creation through the private sector. These 9,000 jobs that we're talking about not only are doctors, we're also talking about people who stand to go and get certificate programs for x-ray techs, office, IT people. So these are jobs that's being created that you'll see in the private sector.
What about these 300,000 or so Mississippians who would be added to the Medicaid rolls? Where are these people getting their medical care currently?
Well, what you see is most of the people who are uninsured tend to use the emergency room, which we know that our emergency room is a place you have high costs, and you have people who are having issues with primary care who go to the emergency room instead of going to a primary care physician because they don't have insurance for their pay. So what we're talking about is we're talking about people here who are working in Mississippi who tend to come from our service industry here in the state, but we're also talking about construction workers, barbers, stylists, people who go and do our work or go about their daily business, who are people who do not have health insurance and right now are trying to find ways to be able to get access to coverage.
Dr. Taylor, what about these 300,000 folks? Should we continue with this system, or what would become of them if we don't expand Medicaid?
Well, I think certainly the best thing for these folks is not to put them into a broken system, into a broken Medicaid system, in which it's worse for patients than if they are uninsured. So I think let's look at how we can help these folks. Now, what we're going to find is that the uninsured are very different. For instance, you'll find that about 20%, actually some numbers are higher, 30% of the uninsured earn $50,000 or more. You're going to find, when we're looking at expanding Medicaid, the expansion is an expansion to able-bodied adults. This is the largest entitlement program in the United States, and we're now going to be expanding it to include able-bodied adults. Well, in fact, this includes a lot of young people that could be working. It includes a lot of college students. Colorado has looked at their numbers for Medicaid expansion. They're finding about 86,000 college students are going to be eligible for that expansion. Connecticut recently expanded Medicaid in 2010. They're already looking at it again, saying, you know, this is too expensive for us, and the costs are coming from kids whose families can afford private insurance. But what you're seeing is parents dropping that insurance, putting their kids on Medicaid. Colorado just wants to do an income test and an asset test. The Obama administration has said no. So they're going to allow the Medicaid expansion to cover folks that don't need it. And that's what you're going to find. A lot of people drop private insurance to go on to Medicaid when you have subsidized insurance for folks that earn more than the poverty level.
Dr. Wiggins, do you think that would happen?
Well, first of all, I think there are some issues with some of the numbers that's been presented. What Medicaid would cover up to 138% people at the federal poverty level. What we're talking about is an individual making up to about $15,000 a year. We're talking about a family of 4, mom and dad with 2 children, making up to about $30,000 a year. Total income coming into that family. So this $50,000 number, I'm not sure where that number is coming from. So what we're talking about is people who go to work, who their employer does not currently provide health insurance. So they still need a way to provide health insurance to their family. I mean, we're talking about families who are really one catastrophic emergency away from losing their home. Losing things are important to us, everybody, and everyday people. So the numbers of what we're talking about is one thing, but really paint a true picture of who these people are.
So what do we do with these people? If, like I said before, if not Medicaid expansion, is there a better solution? You mentioned that Medicaid is broken. Can it be fixed to a level where we could expand it, in your view?
I think we do have a better solution. I mean, to begin with, let's take the folks that are earning 100 to 130% poverty. Those folks will be eligible for subsidized insurance on the federal health exchange that is being created here in Mississippi. And then let's do what some other states are doing, like Florida, like Kansas, like Louisiana. They're reforming their Medicaid program to make it a patient-centered program. And the patients are better off as a result, because we're no longer looking at the dollars, we're no longer looking at somebody's particular political agenda, we're looking at what's best for patients. We'll find that that type of reform is best for them, and then we can look at taking some of that savings to help those folks out.
All right, we're going to have to let that be the last word, gentlemen. Thank you both for being on with us on At Issue. And that is enough Medicaid for one evening, but that's not nearly enough At Issue. So up after the break, we have something special for you. A look into the crystal ball, if you will. Intrigued? Stick around and we'll explain. But while we are away, feel free to jump on Twitter and tell everyone how much you're loving the show tonight. Hashtag #AtIssue is awesome. And if you aren't following at Issue, well, now's the time. You can find us at @IssueMPB. Send us a tweet, give us a mention, let us know you're out there.
Patti LaBelle hosts an all-star lineup, uniting the superstars of 70s soul on PBS.
Everybody say, ow.
Tuesday at 7 on MPB.
Best-selling author and financial expert Susie Orman is back with all new advice for these challenging times.
Today, we are going to start a new movement that we're calling the New American Dream.
Don't miss Susie's powerful lessons on work, family, and your financial future. Susie Orman's Money Class.
Tuesday at 9:30 on Mississippi Public Broadcasting.
The Tinners are back with a dazzling new show. Victor McAuliffe, Clifton Murray, Remigio Pereira, and Fraser Walters. Join us for this unforgettable performance. The Tinners, lead with your heart.
Wednesday at 7 on MPB.
Well, as promised, this entire show won't be about Medicaid. Our legislators have been a busy bunch of people, and between showdowns over Medicaid, they have passed a lot of other bills, and many of those have made it to the desk of Governor Phil Bryant. Who better to fill us in on what those bills are and how they're going to affect us than MPB's own Jeffrey Hess. Welcome back, Jeffrey. Good to have you back on the set with us now.
Thank you very
Let's
much.
start with what happened today. The governor signed a bill related to school prayer.
Yeah, very fortunate for us. The governor had a bill signing ceremony this afternoon. It was called the Mississippi School Student Religious Liberties Act. Bryant and supporters say this is intended to make it more clear to schools what types of forums, religious expression, and student-led religious prayer is allowed. At his signing today, he said that he believes it's completely constitutional and that this is just a method to make sure that school administrators and principals and school leaders know what is allowed and when students can express religion.
This is not the violation of any clause of establishment of religion. The state is not about
the business of establishing a religion, but we are about making sure that we protect the religious freedoms of all students and adults whenever we can. The Constitution allows for that. Yes, we're going to sign it into law. There it is. Thank you.
We've talked about this on At Issue before. Opponents say this is an unconstitutional violation of separation of church and state. It's not the only bill he's signed so far. The governor has also signed a bill removing concealed carry weapons permit records from public records requests.
And the ACLU on the school prayer bill said they're going to monitor this. They don't plan to.
They're going to wait and see how it plays out. Yeah.
No immediate lawsuit anyway. Let's talk about brewing your own beer. That was something that crossed his desk as well.
Yeah, this is something that is on his desk right now. He hasn't signed it yet, but this is something a lot of people in Mississippi already do. This is people that brew beer in their home for their own personal consumption. It's a very popular pastime. It's very easy to get into, but it's also illegal. Until recently, until the legislature took action, you would have had to set up and pay all the taxes of anyone who was a commercial brewery. Something for someone who's brewing at home, that's a pretty heavy burden.
Sure.
Senator John Horn, he's a senator from Jackson. He ushered this bill through, and he explains why it's a good idea to let people brew their own beer at home.
Okay.
You have to be at least 21 years of age. You cannot brew it for commercial sale. An individual can brew up to 100 gallons per year for personal consumption, and a household can brew up to 200 gallons per year for personal consumption. And we do allow for the transport of the beer if it's going to be considered in a competition or an exhibition, but otherwise you have to maintain it in your home.
And finally, what I saw one group described as the most sweeping education reform since 1982, which seemed a bit of a stretch, but still there was something.
Yeah, there's a lot of action on the education front. This week was a huge deadline to get bills through. Charter school bill is still alive. We have the third grade reading gate, which really focuses on third grade reading, still alive. So a lot of these things that the Republican leadership really wanted, that we've been talking about a lot here on At Issue, have survived past that deadline, are still alive, and they're headed towards conference. The Senate chairman of the Education Committee, Gray Tollison, says he's feeling really good about where they're at, and he thinks they're going to have a nice, solid education reform package that maybe they could end up rivaling 1982. We'll see what he has to say right here.
The bills are alive that we came to the session in January that we wanted to see pass. So the charter legislation, third grade reading gate, the pre-K legislation, accountability, the governor's bill. So all of those are alive, and there's some other lesser bills. So yeah, and hopefully by the end of the session we'll have those bills on the governor's desk.
Is it a good idea to pack them all into one big bill?
Yeah, I don't see a problem with that. I mean, you know, you get one vote on it, and I don't see a problem. I hope the House will get to consider that. But we do have other vehicles out there. So as I said, the bills are alive that we are interested in.
And we'll be watching. Jeffrey Hess, thanks. A really quick look ahead now to next week, and it could be a real doozy. If money's your thing, the budget will be a big deal next week as the deadline approaches for funding decisions to be made. We'll be keeping a pretty close eye on all of that. But the big deal, the thing everyone is really watching, is that rumor of a special session. Will it happen on Monday? Well, if it's an issue at the Capitol, it will be at issue here next week. And with that, we wrap up yet another episode of At Issue. Of course, we want to thank our guests for joining us. As always, we also want to thank you, our loyal viewers, for tuning in as well, because without you, we don't even want to think about that. Thanks again. We'll see you right here on MPB next Thursday night.